Good afternoon, everyone. Welcome, and thank you for joining our Faculty of Agricultural and Food Sciences conversation series here this afternoon. Today marks our third faculty seminar in this virtual format, and our two previous seminars were well attended, and they also continue to attract viewers as videos. So for those of you who missed the previous seminar conversations, there's an opportunity to view them via our faculty's YouTube channel. I'd also like to remind our audience that we also have a new Manitoba website called the Make Manitoba Agriculture and Food Knowledge Exchange. And you can find it at makemanitoba.ca as shown here on the screen. In it, you'll find a collection of podcasts, recipes, fact sheets, and other materials that help highlight our faculty's research as it relates to consumers and producers. So please do check it out. My name is Martin Scanlon. I'm the Dean of the Faculty of Agricultural and Food Sciences here at the University of Manitoba. And I'm standing in today for Annemieke Varenhorst, our Associate Dean Research, who is unable to make it this afternoon. I'd like to start off by acknowledging that the University of Manitoba is located on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples. It's also the homeland of the Métis Nation. And we respect the treaties made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to moving forward in partnership with Indigenous communities in a spirit of reconciliation and in collaboration. So welcome again to our faculty seminar series, and which, as I said, we're calling the Faculty Conversation. And the title of today's seminar, as you can see, is Sticky Money, Exploring the Acceptability of Sugar-Sweetened Beverage Taxation Among Indigenous Populations. And we have two speakers today who tell you each about their research, and then they're going to engage in our conversation. And you as a viewer can also participate in this conversation by sending in your questions and comments via the chat platform. So right now I'd like to call on Crystal Jorgensen, the faculty's communication specialist, and Crystal's going to provide some guidance on how the audience can participate in today's presentation.
Thanks, Martin. So today we are using a chat platform called Slido. So if you visit www.slido.com, maybe you can have it open on another window or on your phone. And when you get there, you enter the hashtag POPTAX. That's the code to get into our chat session. And you can pose your questions there for our speakers. We will be doing a Q&A at the end. Just a couple of notes. You want to keep your questions a little bit short. The character count is a bit tight. And maybe just to kick it off, if you're already in slido.com, why don't you let us know where you're watching from? If you're in Manitoba, what location in Manitoba, or if you're watching from somewhere else, we'd love to hear from that. So we'll come back to this later on, Martin. Thank you.
Okay, thanks, Crystal. So we'll review those instructions again at the question and answer section of the seminar. And as I said, today's topic of conversation explores the concept of sugar-sweetened beverage tax. So the World Health Organization, as well as many Canadian health organizations, they've endorsed a sugar-sweetened beverage tax. And this is to address non-communicable disease, though as yet this policy has not been implemented in Canada. And one of the things about the sugar-sweetened beverage tax is it's a regressive tax. And that means that it takes a proportionately greater amount from those on lower incomes. And there's actually consistent evidence of sugar-sweetened beverage intake being higher among populations of lower income, on those populations who report food insecurity, and also among Indigenous peoples. So the World Health Organization has stated that concerns regarding negative impacts of a sugar-sweetened beverage tax for lower income populations is a myth. However, this has not been investigated empirically, and the voices of Indigenous people need to be considered in this policy discussion, and these voices are the subject of the study that our guests today are going to be discussing in the seminar series. And so with that introduction, I'd like to introduce our speakers. Please welcome Natalie Riediger. Natalie has a Bachelor of Science and a Master's degree in Human Nutritional Sciences. She also has a PhD in Community Health Sciences, all from the University of Manitoba. Natalie is currently an assistant professor in the Department of Food and Nutritional Sciences here in the faculty, and she's also a Canadian Institute of Health Research early career investigator. Natalie's been working in the area of Indigenous health for 12 years as a settler ally, including completing her PhD in partnership with Sandy Bay First Nation. Dr. Riediger utilizes mixed methods, i.e. qualitative and quantitative approaches, to best address research questions of priority for communities. And with that, I'd like to invite Natalie to speak for 5 minutes or so.
Thanks, Martin. I will do my best to stay within the 5 minutes, and I'd like to thank the faculty for inviting me to this conversation series today, and I look forward to the conversation. And thanks also for introducing some of the, I call them sticky issues with respect to a sugar-sweetened beverage tax, because they are very sticky and complex issues. I don't think discussions about taxation and the challenges of, bringing together different perspectives is anything new. I'm sure to those of you listening in agriculture, there's always ongoing conversations about taxation and the importance of considering diverse perspectives. And in this case, for a sugar-sweetened beverage tax, how critical it is to listen to Indigenous people because of the epidemiology of sugar-sweetened beverage intake. And so one of the, issues or sticky issues that we're exploring in this study is how two problems are almost at odds with each other. And those are the issue of non-communicable disease or diabetes or sometimes obesity that's often positioned as the problem, and this is the policy that will help solve it, and food insecurity, which Martin also mentioned, that sugar-sweetened beverage intake is higher among food insecure populations, which disproportionately affects Indigenous people. And what we know about food insecurity is that the pathways to ill health, because we know that food insecurity is associated with adverse health outcomes, they include diet and the types of foods people eat and the nutritional consequences of that. But there are also consequences on multiple other health impacts. And actually, there's growing research showing that the adverse impacts of food insecurity are greater in terms of mental health, infectious disease, injury, in addition to non-communicable disease. So we can't just think about non-communicable disease or not consider food insecurity and kind of the impacts that might happen with raising the price of a food disproportionately consumed by lower income people. And then the other issue, which the second speaker is going to talk a little bit about more, is the issue of sovereignty. And that's another concept that hasn't been discussed really by any health organization that's proposed a sugar-sweetened beverage tax. And that is issues of sovereignty and jurisdiction that the other presenter will talk about. So with this study, we hope to collect the stories, experiences, perceptions, and acceptability of a sugar-sweetened beverage tax from Indigenous people in various settings. So on reserve, off reserve, in urban and rural areas, using interviews, but then also looking at survey data and price and availability data in terms of the types of sugar-sweetened beverages that are available, as well as non-sugar-sweetened beverages, because we know that, for example, milk on reserve is very expensive, specifically in remote communities. So that's kind of a brief overview of the study. And then I'd also like to acknowledge at this time, in case I don't remember later, to acknowledge I have a wonderful team and a group of partners that I'm working with on this study. I'm working in partnership with the National Indigenous Diabetes Association and Jeff LaPlante, who's the executive director there, Michael Champagne and Riel Dubois from Fearless R2W, and Byron Beardy from Four Arrows Regional Health Authority, representing Island Lake First Nations. And I'd like to also say that my thoughts are with the communities, the 4 communities there that are currently experiencing a very severe outbreak of COVID, and my other collaborators and students that are involved on the larger project. So I think I'm at my 5 minutes.
Well, I think we would have given you a few more minutes if you're cutting short, but
No,
but if
I'm good.
not, we'll move on to Myra then. Okay, so thanks, Natalie. And next up, we welcome Myra Tait. So Myra is a member of Berens River First Nation, an Anishinaabe community about 6 hours north of Winnipeg. It's also the site of the signing of Treaty Number 5. Myra holds a Juris Doctor degree and an LLM, or a Master of Laws, from the University of Manitoba. And Myra's argued that the courts have failed to ascertain the relevance of Canada's treaties in interpreting the meaning of the Indian Act's taxation provisions. In 2017, Myra co-edited Surviving Canada, Indigenous Peoples Celebrate 150 Years of Betrayal, and that was a response to the Canada 150 celebrations. But also in 2018, Myra received a call to the Bar of Manitoba. Myra's areas of research extend to constitutional inclusion of Indigenous peoples in Australia and in New Zealand, health equity, and of course taxation. And she teaches on social justice and public administration and governance. Myra is currently an assistant professor in the Governance Law and Management program at Athabasca University. So with that, open the floor for Myra to give a background on her relationship to sticky money.
Great, thanks very much. Natalie knows that as a lawyer, I'll use up all the extra time, so I'm happy to have it. Thank you as well, Martin, for your land acknowledgement. And I come to you from Alberta in Treaty 7 territory, which is the homeland and traditional territory of the Blackfoot people. What's not in my bio that you read is that I have a couple decades of history of farming experience. So I can drive a combine. I do understand things like gate to plate discussions. And I understand that the farming community are largely fiscal conservatives. So that takes us then to this very exciting area of taxation. And if I haven't already lost you, here's what I have to offer. So when we think about the health and the science considerations surrounding the consumption of sugar-sweetened beverages, tax is not likely the first thing that jumps to mind. But I think we can all agree that fewer taxes is always better. So let's start with that premise. And I want to address right off this idea that Indians don't pay tax. Now, with any great myth, there's always a kernel of truth. And the kernel of truth is this, that in the Indian Act, and that is still what it's called the Indian Act, and we're called Indians by law. The better term often is First Nations, and so I'll use that term as well. But Indians on a reserve do not pay taxes. So I don't live on a reserve. I do pay taxes. Most of what I consume is not tax exempt, but there is this discrete provision in the Indian Act that Indians who live on a reserve are tax exempt. So based on that myth and the kernel of truth that's in there, we have to ask the question of how effective is a tax on sugar-sweetened beverage for a group of people where we know diabetes is a huge concern, but they don't pay taxes. Okay, so that's problem number one for you. Problem number two is, what if we did apply a levy? And this is a cutesy way of getting around tax law. We call it a levy, or we call it some other name, but we don't call it a tax. So let's assume this strategy was used to include a tax on cannabis, not surprisingly. There's a lot of revenue that can be generated there. Where's that revenue go? Let me ask you, where do you think your gasoline tax goes? Because I've driven all over Winnipeg, and I can tell you, it does not go into road repairs. So similarly, if we're going to tax sugar-sweetened beverages on reserve by whatever way means possible, where does that tax go? Where does the revenue go? Which brings us then to the question of self-determination. And Martin, I appreciate that you mentioned not only a land acknowledgement, but that the respect for treaties. Where does that taxation go? Where do the revenues go? Who gets to say how they're spent? Who gets to say how First Nations people who live on or off reserve, or Inuit, or Métis people, who gets to say what they eat? Who gets to say what taxation gets spent on? Where's that revenue go? And so it really becomes an issue of self-determination. And that brings us really to treaties. Our treaties with settlers said, we will live by our law and we will determine what is best for our people, and settlers would do likewise. Now, we all know that the wheel fell off the cart long ago on that. And yet we now have in our Constitution, we've constitutionally entrenched recognition of Aboriginal and treaty rights. And so that brings us back to a sugar-sweetened beverage tax. As self-determining people, we need to be consulted, and we need to be understood as people who have a stake in this decision. For many First Nations, accessibility to food, to good food, is not a given. Accessibility to clean water is not a given. So let's start thinking about how we might deal with food and water and access to healthcare, which is also not a given for those who are on reserve and for those who are trying to access those services off reserve in what are typically very economically marginalized communities. So Martin, I'm going to bring it back to you one more time. You gave a land acknowledgement, and I want to ask our listeners, what does that mean to you? That you live and you play and you learn and you work on Treaty 1 territory. What does that mean to you if it does not mean that we need to respect that First Nations people must have the right to be self-determinant?
Great, thank you, Myra. That's a great and thought-provoking introduction to the whole topic. So thank you for framing that well. So maybe then I'd like to open it up to both Myra and to Natalie to now have a general discussion on the topic of sugar-sweetened beverage taxation and indeed to autonomy for Indigenous peoples as a component of this taxation, or as Myra has put it, a cutesy way of addressing a levy issue. So go ahead, Natalie and Myra.
Do you want me to go first?
Yeah, or if not, maybe I'll put the topic to you about the myth, supposedly, that why does WHO actually call this a myth? So maybe that would be a way of starting the conversation.
Well, I think the answers to the two questions, for me anyway, are almost the same, which is that nobody has asked low-income people what they think, and with the aspect of self-determination and sovereignty is nobody has asked. It's been proposed, and health organizations have gone to the federal government. It was on the agenda. Many provincial political parties have put it on their agenda, and yet nobody asked. And so it can't really be a myth, or I guess it could be a myth if nobody asks. And so I think really that's what, to me, the study is about. And I'll let Myra respond to that.
Well, I only add a small correction that the Green Party has asked, and I've told them. They did have a sugar tax on their platform at one point, and I think I sufficiently gave them fodder to consider to maybe revise that platform. Because when it comes down to it, how do we deal with these very serious problems of diabetes, of lack of water, of food deserts, and whether it's in the middle of Winnipeg or in a northern community in Manitoba, how do we deal with those issues without penalizing the very people who are suffering from them? And Martin, you point out that this tax is regressive. And so I'll just reiterate that again, that for the average person who spends, I don't know, $100 a week on groceries, if part of that is a tax on sugar-sweetened beverage, you'll pay that tax whether you make $100 a week as a salary or whether you make $100,000 a week. You're still paying the same amount. And so in that way, this kind of tax penalizes the very people who are least able to pay for it. Let's, as a society, start thinking about ways that we can address those bigger issues of access to good food and clean water.
Yeah, so Natalie, how would we then, if there is not a discouragement, regardless of whether it's regressive or progressive as a taxation, how do we discourage the consumption of sugar-sweetened beverages if that's seen as an outcome to a health outcome?
That's a good question. I really do believe in giving people what they need. Like Myra said, having water and access to food is probably the best. In the research we've done so far, everybody is aware of the health outcomes of drinking sugar-sweetened beverages. It's not, to me, a matter of education that people are largely unaware. I don't think we've interviewed one person who was unaware. So the message has been out there, and the research shows sugar-sweetened beverage intake has decreased dramatically in the last 10 years in Canada, as well as the US. I'm pretty sure in Australia as well. So the message is definitely getting out there, and people are consuming less. Although I question, what types of beverages are always included within that definition of sugar-sweetened beverages, because there are so many different beverages that have sugar but aren't always included in survey definitions or the tax definitions in countries that have a tax. Sorry, that's a long-winded answer.
But let's pick up on that, because I think one of the most fascinating examples that you came upon, Natalie, is that while a can of Coke is taxed in many of the jurisdictions, the can of Coke is taxed. The fancy latte from Starbucks is not, because it has a little bit of milk in it. So when we again look at the demographics of who's consuming these, right? Are the people who are least able to purchase an alternative paying that tax? I think the answer is generally yes. Whereas the people who are most able to pay more are not taxed at all. Right. So the question becomes really complicated when you want to start looking at what are deemed Pagovian or sin taxes. Right. Has tax on tobacco really reduced smoking, or has it been education? And so I think, Natalie, to your point about the jury is still out on the efficacy of a sin tax, there's a good example. Why are there fewer smokers? I don't know. It's not part of my lifestyle, so I have no idea. But if there are, what brought about that change? Was it an awareness of the health impacts of smoking, or was it because people who have a true addiction said, gee, I don't like paying this tax. I'm inclined to believe it's the former.
I'm also inclined. Part of the reason, though, in research, it's really hard to know what exactly makes, or if a policy is effective, right? Because it's a real world. We're not doing any kind of randomized controlled trials. So smoking has gone down. We know that smoking has gone down, and public health loves to toot its own horn. That's one of our greatest achievements is smoking. And I mean, you know this about me. That's part of why this research interests me, is my previous research with smoking and in my PhD with Sandy Bay First Nation, because we found that smoking actually went up. And then when I dug a little further, it wasn't quite the public health achievement I had, the impression I've been given, because there were widening inequalities in smoking and no progress on addressing commercial tobacco use among First Nations. And so, and really a lot of adverse impacts in terms of, being blamed then for non-Indigenous people smoking, because, there were cigarettes being, non-taxed cigarettes being smuggled. And so to me, I thought, ooh, there's a lot of lessons we could learn from tobacco in terms of thinking about sugar-sweetened beverages more. And yeah, the different types of beverages. I mean, from what we found already in our research, in the jurisdictions that have implemented a tax, there's just as many sweetened beverages that get not included in the tax that have the same amount of sugar. So there's, you call them loopholes? I don't know, but it's something that needs to be said and demonstrated and really thought through. And then the second part of that question, which I hope we still have to answer, is who's consuming those that are taxed and not taxed?
So I want to pick up on this idea of loopholes, Natalie, because I want to know where they come from. I want to know who, as someone who understands at least a thimbleful of what it takes to do legislative drafting, there has to be some rationale behind certain loopholes. And I'm just going to put it out there that I suspect that the stereotypes of hundreds of years of colonial thinking about Aboriginal people plays into the end product of that legislation. So when we think about smokers, we immediately have, I think it's a stereotype. We think of people who are lazy, who don't work with both hands, who are maybe, they clearly can't be living healthy lifestyles. They are probably not as intelligent. There's all sorts of horrible stereotypes. And how much more so are stereotypes around Indigenous people influencing the way we think about diabetes and obesity and poor health, right? So those stereotypes inform the policy that comes out at the end. And in some ways, the rationale goes something like this. Well, if they're not going to exercise and they're not going to eat better and they're going to make these poor choices, they should be penalized. Except we don't apply that same rationale to the CEO who sits at his desk and ends up having to go for a quadruple bypass, right? Because he is a workaholic and maybe drinks scotch every day. I don't know, right? But it's those stereotypes that then begin to inform how our policy is rolled out. So we need to back up quite a ways before we can come to the conclusion that this is best for those people. Because I'll tell you, those people actually have some ideas about what's best for themselves. And I point no further than what I call expressions of self-determination that First Nations are taking even today in closing their communities off to traffic in and out of their reserves. I don't know if they actually have jurisdiction to make those choices, but they're doing it because they know that that is how they're going to keep COVID under control in their own communities. Now, if they can manage a pandemic, I'm going to suggest to you they can manage pop consumption. Okay?
So, Martin, do you want to go ahead? Because I think there's questions coming
Yeah,
in.
go ahead, Natalie, if you've got a rejoinder or a support for what Myra's just said.
I mean, I was taking some notes. I could respond. I don't want to shortchange the audience either.
Yeah, we've got a couple more minutes, so please do go ahead, Natalie.
Okay, well, Myra, maybe I'll pick up on the point about, you know, the colonial thinking and the types of beverages that get taxed, and perhaps would interest the agricultural, you know, audience. And that is that pretty well straight across the board is that any beverage that has dairy in it doesn't get taxed, no matter how much sugar is in it. And I think that, you know, that reflects, you know, the power of some stakeholders in being able to influence policy discussions, but also the legal documents. Nobody has an argument. WHO doesn't write about chocolate milk. It just kind of slides in there, you know? And then to pick up on your comment about stereotypes, absolutely. That's also, as you know, a big part of the research project is to look at that across the different populations about how social narratives play into it, because that's often what is, you know, underlying all these policy discussions is how we talk about issues, how we talk about, you know, the foods people eat or don't eat, and how their personal choices and how, you know, these social narratives are gendered. There's racial stereotypes. Those are all aspects that we're exploring and finding. So definitely there's a lot of reinforcement of existing oppressions.
So the flip side of that, I guess, is coming to understand some of the cultural meanings of food too, which I've found really fascinating to hear from your research, Natalie. And the example that stands out in my mind is this idea that if somebody goes and buys a bottle of pop, it better be a 2-liter because they're expected to share, right? Which is not a super strong value in non-Indigenous community. I'm not saying white people don't share. I'm saying there is an expectation in Indigenous communities that you will share, right? And so that promotes that whole maybe overconsumption of sugar-sweetened beverages, that the same cultural meanings around food aren't necessarily there in non-Indigenous communities. I think that's fascinating.
Yeah, no, it is. Go ahead, Martin.
Yeah, I was just going to worry with so many complicating factors. How do you tease out then whether taxation is a disincentive for people, regardless of self-determination rules, whether in general a tax on sticky money, as you say, is effective?
Well, I'll give a short answer, and Natalie, maybe you want to speak more as the scientist. I think the answer to your question, Martin, is in the question. We can't know because it is so complex. So let us decide for ourselves.
I think you just said it all.
Okay.
Good. Then that's a good time to turn over and take some questions from our viewers. So Crystal is going to just step in again and remind us how we can share our questions for Natalie and Myra.
Okay, thanks, Martin. Great discussion so far. So just a reminder, and you'll see it crawling across the bottom of the screen, that you can pose questions at www.slido.com and use the code #PopTax. We've had quite a few people respond to our first query about where are you watching from. So I'll just give you a quick snapshot. We've got quite a few people watching in Winnipeg, Fort Garry, Richmond West, St. Boniface, but we also have New Bothwell, Manitoba, Thunder Bay, Ontario, Edmonton, Alberta. So we've definitely got people watching all over the place. And I'll maybe just start with one of the first questions that came in. It says, and this may be directed to Natalie, they say, how much pop sugar is being consumed by low-income people as compared to others? I don't know if that's something you can answer.
I don't know the exact amount right off the top of my head. I'm thinking it's over on average Sorry, what was in which population? In the Canadian population?
It just says low income people as compared to others. So
I don't know the average, but I'm also going to say that, because I've written about this, is I don't know that the mean or the average is necessarily the value we should be looking at, because I don't think, and there's also research showing it's not normally distributed in the population, meaning that there are higher consumers. And I think when we think of the health effects, you know, the health effects are very different if you're consuming two liters a day or, you know, 1 can every couple weeks. So the mean obscures, I think, what to me is a more relevant issue, which is very high intake. Sorry, the mean is, I know it's over a can a day, which would be 355 milliliters. I'm pretty sure that's approximately what the mean is. But again, I don't think it has that much importance.
So this question might have a little more response. Who are the main influencers regarding diet change in our remote First Nations?
Oh, that's a good question. In some respects, and Natalie, I defer to your thoughts on this as well. I guess I see it less as who are the influencers as who continually drops the ball. You know, Justin Trudeau promised as an election, part of his election platform, that he would solve all of the boil water advisories by 2020, right? And recently it was announced that, oh, gee, shucks, I guess we won't be able to do that. So what alternative is then left for a community that has had a boil water advisory for possibly decades? Bottled water may be similarly priced to bottled pop, but any parent will know you put a bottle of water in front of a kid and you put a bottle of pop, and we know which one they're going to reach for, right? Same as youth. They're not going to go in and pay $5 for a bottle of water. I typically don't, and I can afford the bottle of pop. You know, I can afford the bottle of water. That's just a reality of human nature, I think. So it's not so much who's driving the policies around availability of these food products. I think it's more about who's dropping the ball, and why don't we have grocery stores in the north end of Winnipeg? And why don't we have, you know, you can buy a case of beer in Churchill for the same price as you can in Winnipeg, because it's government controlled. Like, is that, do you not see that as a problem? I do. I'd like to see a jug of milk the same price in Churchill as it is in Winnipeg. Or as Michael Champagne points out, you know, we've got 99-cent pizza in Winnipeg. Where's the 99-cent broccoli? Because vegetables are very expensive.
Yeah, that's a good answer. I don't really have that much to add. I'm not really quite sure what the questioner was getting at in terms of a who, like if you're thinking of people, or I go to systems, like Myra said, like the government systems. As opposed to who, although there are people in government. I don't know if you're thinking of like social media influencers or advertising, because that's, I mean, food choices are very complex, and why people make various decisions about food. I mean, that also assumes people have a choice.
So if I can follow up then with Myra on that, you would, just because you talked about the clean water and the boil water advisories. So the issue of access to clean water probably is a factor affecting the consumption of sweet beverages on First Nations.
Yeah, I don't know how it can't be. You know, even using potable water that simply tastes bad, what do? You add something to it, right? So I don't know how it can't be a factor.
Yeah. Crystal, do we have more questions from the audience?
Yeah, we have one here from Jay Smith in Edmonton. He's asking, the Navajo Nation in Arizona has a beverage sweet tax. How has that worked so far?
That's a great question. I don't know the outcome of, sugar-sweetened beverage intake as a result of the tax or revenue generated. I mean, this kind of speaks to self-determination, like Myra talked about, and that's their decision. And from my understanding, the revenue would go to the Navajo Nation. So they would get to determine what it's used for. And yeah.
All right, I have another one. Dustin Thiessen is asking, if a community through a self-determined process decides to tax pop, what evidence is there towards the efficacy of this type of policy?
So I'll answer your question, Dustin, with another question. Does the United States get to review our health policies, and do we have to justify ourselves to them or to European nations or to anywhere else? So I think the point is not so much, what's the proof of it? The point is that First Nations are sovereign nations and they can decide for themselves, just as Canada is a sovereign nation and would rebuff any attempt by a foreign nation to say, we think you need to prove why you have this tax. That's the simple answer.
I will add to that and say, in terms of what we know in other jurisdictions about how lower income populations have responded, it's very challenging to look at this kind of research, because at least in the US, which is probably the most comparable place where we have data, they've only ever implemented it at a county level, which oftentimes is a city. And so what happens is actually a lot of cross-border shopping. And then what they have is a huge spike in purchasing before the tax goes into place. And then it goes down immediately after, because if you've stocked up, you're going to buy less after. And so there was the original, yay, it went down. And then they're like, wait, people are just buying it at the Costco outside of Philadelphia. And now the Costco inside Philadelphia, well, not so much Costco, but other businesses lose customers. And so I didn't bring this up originally, but this is also another part of the study that Michael Champagne had suggested we include, which is the small business perspective. And because when WHO wrote, that the negative impacts on low-income populations are a myth, they also wrote that the impacts on small businesses were a myth. And again, there was no evidence. And so we also spoke to small business owners as part of this study to get those perspectives. Sorry, I went way off topic.
No worries. Another question, and this may have already been addressed. Tressa is asking, I would love to hear a bit about what First Nations individuals who have been interviewed have to say about the tax.
I don't have enough time for that. I would say, so we've only done interviews already in the North End. My student, Maria Kisselgoff, is working with Michael Champagne and Riel Dubois, and eventually she will do a presentation on that, discussing those findings. I don't know how to summarize them in a nutshell, and we're still analyzing that data. There's a lot. The results really touch on a lot of the issues we've already discussed here, which is, the challenges of living with food insecurity and the challenges that participants said they'd face if the price went up, particularly mothers. We did hear about sovereignty. The issue of what happens with revenue is, factors into this conversation. And in any policy development, and especially something with, if you're paying into it, is you want to know where the revenue is used for. And there's a lot of government distrust, which, is backed up by a lot of historical experiences. So that's really a very, nutshell of what we've heard. We haven't done interviews on reserve yet. we're still hoping to do that, but pandemic makes it tough.
I think the only thing I can add to that is on a
Okay,
theoretical
this
level.
this is more of a oh,
Yeah, there must be a lag, hey? I was just saying that I think on a theoretical level, the two most contentious parts of the Indian Act are around how the federal government determines who is an Indian, so the criteria of status. And then, of course, what's linked to that is this tax exemption that applies only on reserve. But now with the development of an urban reserve in Winnipeg and Kapiong moving forward, then it becomes a far more relevant issue to urban populations. Again, I just return again to that theoretical basis that as sovereign nations, First Nations should not be paying tax anywhere for anything. That's my position. And, you know, I can almost hear the outrage all the way here in Alberta from those people saying, what, you know, everybody should pay taxes. Well, there's a whole history behind this unique status around taxation that I think needs consideration.
Crystal, do we have more audience
there's
questions?
yes, can you hear me?
Yep.
Yes. Okay. So a statement from Joyce Slater. She says, I wonder how much money a soda tax would generate annually versus the CEO bonuses received in companies that accessed the CERB. Not really a question.
Totally agree with you, Joyce.
Head on.
A question from Sarah Doran. She says, is there a way normal people can get involved in this issue? So how do people get involved?
I would say, I mean, we should all be advocating for clean drinking water on First Nations reserves. To me, that's something as, you know, vote for people who said this is a priority. I mean, that's the beauty of democracy. It's a whole other topic.
Yeah, and the whole idea behind evidence-based policy, right? That at the end of the day, I'm not necessarily going to vote for someone that just says cut taxes, because you know what? I want healthcare if I get sick, I want there to be a place to go. And so we need this rational approach to policy. And I think that's why I have advocated in this study for the necessity of this bigger view that we can't simply look at the science of sugar relative to diabetes. The science is pretty clear on that, but it's a much, much bigger discussion, and it needs to be informed by things like treaties and tax status and food deserts and clean water. And so just as Natalie is suggesting, we need to be advocating for solving problems, not just creating another tax.
Mm-hmm. And I think this is even more important now as we're hopefully coming out of this pandemic. I mean, we're going to have to pay for, you know, all this spending. And so how are we going to be doing that in a way that's equitable going forward, I think is really important. I don't know where this policy sits or will sit on the political agenda, you know, when this is all over, but there's already been discussions about increasing taxes and how we're going to pay for this, but the pandemic didn't have proportional impacts. You know, we've seen widening inequalities. So what we're going to have to do is, you know, make concerted efforts to reduce socioeconomic inequalities. And I mean, taxation is the main structure with which we do that as a society.
Okay, another question. Would a shift to low sugar diet drinks happen if a sugar tax is used? And is a shift to sugar replacements better for health?
That's another sticky issue, which we didn't talk about in this presentation. I told you, Martin, we could talk forever. So yes, I mean, that's a whole other topic, and definitely that has come up in the interviews. People feel very strongly for or against diet drinks, and in terms of what types of drinks are included in different jurisdictions. Diet drinks were kind of one of the more split ones. So some jurisdictions have chosen to tax diet drinks like Diet Pop. In terms of the health effects, I'm not as well versed in that data. I know that there's somebody else at the U of M who's done quite a bit of work on the health impacts of diet drinks, I think in pregnancy. So that's Dr. Megan Azad. And I think that they're finding that there are, also some adverse health effects of consuming diet beverages. But again, nutrition epidemiology is a very challenging field to tease out health effects of beverages long-term versus short-term. I'm not going to advocate for people with type 2 diabetes to avoid diet drinks in terms of managing their blood glucose. It's a sticky topic. Would I say that they're better to consume for your health as opposed to a full sugar Coca-Cola? I would say yes.
All right, and we've actually run out of questions, but there is just one more statement here that someone made, and that was the expectation of sharing is also true for the immigrant communities as well. So it is a concept, I think, that is definitely out there. I'm just going to draw from one of the questions that was provided earlier.
Maybe Myra wants to respond. I can tell you to jump in about diet drinks.
Okay, yeah. My thought was this, that I think education plays a huge role in understanding how policy should be developed. So partly it's education about health. Is a diet drink better than a sugar drink? Is that Starbucks latte better than the whatever, right? So we need some education around that. The other part, I think, and that I think is important, and it comes back to taxation again, of course, is that we need to understand why certain things are taxed and certain things are not taxed. And let me give you a completely different example. Until I think it was 2016, the Canadian child tax benefit checks that go to all parents would be issued in a certain way such that if there were two mothers, typically, I don't think the legislation was gendered, but if there are two parents sharing accommodation in a home, only one of those parents, even though all they do is share accommodation, only one of those family units could receive a child tax benefit check. Now, what's the rationale for that? Obviously, both of those parents have children who have needs, and part of our rationale is we want to support children in our society. But why is this unique situation of two independent parents sharing a roof, disqualifying them from both receiving it? And it goes right back to the 1960 Carter Commission, where it was set out that the Canadian tax system would privilege the mother, father, 1.4 children, nuclear unit. And I think we need to understand those prejudices that are built right into our tax system and begin to challenge those, because you know what? That nuclear family has never, ever been the norm. Not in Canada, not in Europe, nowhere. It's numerically never been the norm. It's only been normative that this is the one that we privilege. So we need to understand the basis of these taxes.
All right. I'm just going to read the last two. Sorry.
Go ahead, Crystal.
Okay, sorry, I have a my end. I'll just give you the last two questions, and then you guys can just talk it out. Here's one. Regarding the concept of self-determination governance, what examples do you have regarding decisions by First Nations people with respect to food security? And what do you think about the link between taxation and stigma? Is this a possibility for a pop tax?
Your choice, Natalie.
I could talk about either. I think we could probably only have time for self-determination. There's lots of evidence that communities that are have more ability to self-determine have better health outcomes in terms of the healthcare system. And with there was a healthcare transfer policy, I believe, that went into place in 1984, where federal government turned over control to communities. They had to apply, but then communities, the longer they had control, the better the health outcomes. Go ahead, Myra.
Sure, we see that in BC, especially. Taxation and stigma, absolutely. That goes right back to those stereotypes that if you are fat, well, you're probably lazy. If you smoke, you're probably not as intelligent, right? But the CEO who needs that coronary bypass, wow, he's pretty amazing. So again, it comes back to education. That lifestyle's no better than the first two in that list.
I echo that. And that's also another part of the study is we're looking at stigma and different types of stigma, weight stigma, and how that links to parental or specifically maternal stigma, because there's a lot of judgment, particularly towards mothers and disproportionately felt by Indigenous mothers in terms of scrutiny on parenting. And that has historical links, right to, that's the type of discourse that underpins residential schooling as well.
Okay, sounds like you've got some really perplexing problems to tackle in the study. So good luck with the study. And we're out of time today, but again, I'd really like to thank you, Myra. Thank you, Natalie, for a very stimulating conversation here in the faculty seminar series. So thanks very much for the time.
Thanks for having us.
That you've taken.
It's my pleasure. Thank you, Martin.
Thank you, Myra. So over the next few months, we're planning several more faculty conversations. And so if I can ask you to mark your calendar for Wednesday, February the 27th, when we'll be joined by Dr. Kyle Bobbywash from the Department of Entomology and two of his colleagues, Emily Missy-Bit Macaulay and Erica Obendorfer. And they're going to be talking to us in this conversation series about the topic of Indigenous engagement and leadership in science. So watch for our updates on this topic on our website or our social media accounts, or by visiting makemanitoba.ca. And if you don't already receive our Aggie news, you can email us at agfoodsci@umanitoba.ca. So as on the screen here, agfoodsci@umanitoba.ca, and sign up. So thank you very much for your engagement in the questions for Myra and for Natalie, and look forward to seeing you again at the next Faculty of Agricultural and Food Sciences conversation. Good night.